loud and clear.
Okay, guys, welcome back to Black Ambassadors of Change. Today we're with Dr. Alexander Goss to be precise. And we're going to talk today about the correlation between oral health and your overall physical health and how Dr. Goss can help you maintain that and improve that as well. So, hello, say hello to the people.
Thanks. Welcome to. Glad to be here. I'm Alex Goss. I'm the founder and owner of Aesthetic Dentistry of Manhattan. We're a cosmetic dental practice located here on Midtown Manhattan, 58th Street in Lexington. Aestheticdentistryofmanhattan.com if anybody's looking for us out on the web.
Okay, so how long have you been practicing?
So I graduated from dental school, proud graduate of the University of North Carolina, Chapel Hill, go Heels. Graduated in 2010. I moved up to New York to do a general practice residency. Shouts to Kings County Hospital in Brooklyn.
Nice.
So that was a one-year
Brooklyn.
program. That was a one-year program, and so I've been in private practice since 2011.
Okay, how long have you been in this location?
So I founded this practice in late 2014, but at the beginning I was just renting a little piece of somebody's office, trying to stake my claim out here in the dental world. And the practice was, successful enough to enable me to open this state-of-the-art facility in 2018. So we've been here for a little bit over 2 years right now.
Okay, that's great. So you're a general practitioner?
Yeah, general dentistry, we are able to treat all dental needs. We have a focus on aesthetic dentistry or cosmetic and restorative dentistry, but any kind of dental needs that you have, we have the training and the skill set to provide.
So in that train of thought, how often do you recommend a patient to see a dentist?
So that's a great question. Our baseline recommendation for our patients is to come twice a year for dental visits. And the philosophy behind that is basically one of prevention or preventive healthcare. The buzzword for that these days is wellness.
Yes.
And, I like that because when I look at the definition of wellness, it means actively pursuing a state of health. So basically what we have is an opportunity to do two things in pursuit of that goal. The first is to, through our dental cleaning, remove the plaque and tartar buildup on people's teeth, the irritants that are contributors to dental disease like tooth decay or gum disease. The second opportunity is through our examination, we're able to evaluate our patients for early stage markers of early stage tooth decay, early stage gum disease, so that we can give treatment recommendations, home care recommendations, so that we're able to, in a low cost, non-invasive way, be able to arrest the progression of these disease, sometimes even reverse the progression of this disease, so that we're able to help our patients avoid costly, time-intensive, money-intensive dental procedures.
So what exactly is gum disease, and what are the initial symptoms of gum disease so people can know if they have gum disease?
Sure. So gum disease is an inflammatory condition or an inflammatory disease that attacks the gums and supporting bones of your teeth. The Surgeon General report of 2000 has suggested that up to 50% of all American adults suffer from some form of gum disease, and it is a leading cause of tooth loss in adults.
Yeah.
So basically the signs and symptoms that you would see at home are bleeding in the gums, swelling in the gums. Those are the initial presenting symptoms or signs. You might also notice looseness in the teeth, mobility of the teeth, bad breath, bad odor or smell in the mouth, things of that nature. And then once it gets into an advanced stage, you start to see loss or erosion of the bone support of the teeth.
Okay. So with this amount of bacteria in your mouth, from what you're describing, how does it impact your health? And I want to piggyback on that. And what type of nutritional education do you guys get in dental school, maybe to correlate those two things, your diet? Does it have any kind of impact on maybe your oral health, your diet and stuff?
Absolutely. We think of nutrition as more affecting the dental disease of tooth decay or plaque-mediated dental disease. But to answer your first question, gum disease is an important conversation that we have with our patients because there have been some very well-established correlation or links between gum disease and some other well-known inflammatory diseases that affect the body.
Such
You're
as?
thinking cardiovascular disease, you're thinking risk of stroke, arthritis, there's been correlation with diabetes.
Really?
So these are all things that once we as dentists can start to see our patients, okay, you're presenting with signs of this inflammatory condition, we're able to jump in and say, hey, you really might need to talk to your primary care physician about testing you for presence of some of these other problems because they are known to be correlated. It's not a causation, like because you have gum disease, you will get cardiovascular disease. It just means your risk is higher. So it's a risk management approach to things.
I got you. So that being said, the whole story, people have big phobias about dentistry.
Sure.
Or going to a dentist, I should say. What do you do to alleviate those phobias?
So the biggest thing that I can recommend is just to really gently suggest to not be afraid of the information. I feel like a lot of phobia or dental anxiety is a fear of the unknown.
Yeah.
And I get it because you are unable as a patient to see what's happening to you.
Yeah.
But if you are just willing to have the conversation about, what is concerning you, what your options are, then a lot of times that can break down some of the psychological hurdles towards moving towards a state of better dental health. That's why here at the practice, we do consultations for a nominal fee, just $50, that will allow you to just get an idea of what your options are in terms of treating anything that's concerning you, and we apply that to the course of treatment. So effectively, it's free.
Yeah.
But that's the biggest risk biggest hurdle that people have is just getting over this psychological barrier towards starting dental treatment.
Okay, so sometimes you hear people say, well, I might as well just pull it out when they have a toothache because then I won't have that problem again. Could you explain to people why that is not a good idea?
Well, there's two reasons that I would say that that's not what I would recommend. The first is that tooth loss is irreversible. When people are in my chair, I call it the nuclear option, right? If you have tooth pain, the nuclear option is removing the tooth. And I tell them once it's gone, it's not coming back. And the problems that can lead to are in digestive issues. People really don't tend to think of teeth as an organ, but they are an organ. They're the entry point into our digestive system. So once you lose your teeth, you lose the ability to effectively prepare food to enter into your digestive system. So then we start to see problems like indigestion, acid reflux, or any other type of digestive problems. The second is that if we can restore a tooth to form and function, that's really what our goal here at the office is. We're trying to maintain people's natural dentition as best as we can. Right. So our recommendations are always towards the more conservative, least invasive treatment options to deal with problems. I in my time at Kings County encountered this a lot, which was people would come in with a really small cavity and say, "Doc, just take it out." And you're like, wait, all you need is this little small filling to repair your tooth and you'll be fine. Right. And people just didn't even really understand that was an option for them.
Right. So you spoke about periodontal disease before, and what is there a cure for periodontal disease, and what is the treatment for periodontal disease?
So a great question again. So I would not say that there's a cure for it. Our treatment goals tend to be towards arresting disease progression. So periodontal disease or gum disease exists on a spectrum. starting with gingivitis and advancing towards the chronic periodontitis, which is marked by severe bone loss around the teeth. Once you start to lose bone around the teeth, we can't ever regain that bone back, but our goal has to be to try and prevent future bone loss from occurring. So the treatment is to, sometimes is known as a deep cleaning.
Yeah.
I hate that word here at the office because it suggests that our normal preventive cleanings are not thorough. So we tend to call it periodontal treatment or scaling and root planing. And that treatment is designed to remove the irritants that have accumulated on your teeth, the plaque and the calculus or tartar deposits that are basically bacterial in releasing toxins into the gum and bone apparatus. So we remove all of these irritants. We try to promote a new healthy attachment of the gum to the tooth, and then also recommend really trying to emphasize normal, more frequent maintenance visits here in the office, just so we can take better care of our patients.
So that being said, so we have people who haven't been to the dentist for years and they've already lost teeth. How do we address those lost teeth and restore their mouth maybe to some sense of normalcy? What kind of options are available? So like you were saying, because chewing is very important to prepare your food for digestion.
Absolutely.
So dentures, I'm assuming, is not the most efficient way of fixing that problem.
Right.
What other choices do you have available?
Well, dentures were the historic option for replacing teeth, and I think of them the same way I think of silver fillings. They're antiquated, and there's just something that's so much better out there, and that is the dental implant. Okay. So we are able with the dental implant treatment to replace a tooth, not only at the surface, the part that you can see, but the root of the tooth, the part that you can't see that's embedded in the gum and the bone. It's a really fascinating treatment because we can basically implant this titanium screw into your jawbone, and your body grows into it. Right. The bone of your jaw grows into the threads of the screw, so it becomes fixed in your mouth. And you can now treat this the same way that you would treat a normal tooth. You can load it the same way, you can put the same chewing forces on it, because that's really the problem with dentures, is that you cannot chew with them as effectively as you can with your natural teeth. With dental implants, it's definitely something that's possible.
So what's the process like, as far as length and I would say comfort?
Sure. So it is a bit more invasive than a denture treatment plan for sure. Here in the office, we have a really great digital workflow that we're doing with our dental implants these days that's very exciting. So our treatment time, basically from start to finish, takes about 4.5 months. And that's just because of the science of that process that I was talking about, which is called osseointegration. And that's the process wherein the bone of your jaw grows and fuses into the dental implant fixture. But that process is a 90-day process, which is all happening beneath the surface. You as the patient aren't even aware of that happening. Usually we're trying to get our dental implants done in like 3 appointments now. So we have an initial records appointment where we take all of our necessary x-rays, an intraoral scan. We do our guided surgery, which I'm happy to talk to you about how we get that done as well. Yeah. We have an invasive appointment, which is the dental implant surgery. That one is done, even though it sounds very scary. Most of my patients who have it done at the end are like, oh, that wasn't that bad. Yeah. Usually takes about an hour to do. Under local anesthesia, a very mild recovery process. You come back in about 3 or 4 months. We take another intraoral scan to get the tooth or crown made for the dental implant. You come back, we screw it in, and now you're good to go.
Oh, good. Another thing, I've often heard, especially people in our community, talk about going to the dentist and they didn't see an obvious cavity, and then the dentist goes into the tooth and goes, oh, you need a root canal, and then they claim that the root canal caused pain. Could you explain to us what a root canal is and what the root canal is preventing, or what are you hoping to treat when you do a root canal, and what's the effect of not treating that root canal?
Sure.
Tooth that needs that root canal.
So a tooth that needs a root canal is typically a tooth that has suffered from either some traumatic injury or from some deep dental decay. And inside each of our teeth, which is a living fixture, there exists a pulp canal or pulp chamber that contains blood supply to the tooth and also a nerve which provides sensory innervation to the tooth. Since tooth decay is a bacterially mediated process, if that decay reaches the nerve of your tooth, we now consider that tooth to be infected. And the root canal procedure is designed to remove that infection from your body. So it's always what we consider to be a curse word in dentistry because it's considered to be a painful procedure, but I think that's also an antiquated notion because of the advent of much more powerful and effective dental anesthetic. But the process itself just involves removing the nerve and the blood tissue from inside of the tooth and sealing the tooth with a rubber-like material that's called gutta percha. The risk of not treating a tooth that needs a root canal is that the tooth will continue to decay, and now your infection can develop into something that potentially could be life-threatening. We have heard stories of untreated dental infections killing people. I know that when I was doing my residency, we saw people with untreated dental infections ending up in the hospital for several weeks due to the bacteria spreading into the bloodstream and things of that nature.
Poison?
Sepsis, exactly. And so it's not like something that will just go away on its own. A lot of times people feel that the problem has gone away because the pain has gone away. But all that really means is that the nerve has been eaten away by the bacteria and is no longer sending signals to the brain that something is really wrong with your tooth.
Right. So there's no treatment besides actively removing the abscess or the infection from the tooth, right? Manually removing it. Well, permanently, actually. There's no permanent treatment except for removing the bacteria permanently.
Right. So that's the conversation that I was mentioning earlier when discussing treatment options with patients. When you get to the point where we're recommending a root canal for your tooth, really the only other treatment option is to extract the tooth.
Right.
So then you're starting to start that snowball effect of all of the consequences of removing the tooth. If you can treat the tooth effectively and safely and again restore it to form and function, and I think that's a much better option for the patient.
So let's move on to prevent, because I see a lot of commercials on television with clear aligners. And I just always wondered how effective is that technology, and what's the consequences of not fixing crowded teeth health-wise?
So clear aligners are, I think, an amazing treatment option. We do a lot of it here in the office that can correct what's called malocclusion, which means misalignment of the teeth or maybe a bite relationship between the teeth that's not really healthy for you. It's really great for our adult patients who are completely opposed to traditional metal braces. It's an effective treatment option if the patient is very compliant with the treatment. A lot of times people think that clear aligners are something that should only be done for aesthetic reasons, people being unhappy with the smile. But we do know that misalignment of the teeth, crowding of the teeth, can have an effect on your body's natural ability to cleanse the teeth after you eat or drink anything. So once you align the teeth, your teeth actually become much healthier as well. So there are people that we recommend it for who are just having problems keeping their teeth clean. They're coming in for these appointments every 6 months with a lot of tartar buildup on the teeth, and they're just not able at home to keep their teeth clean enough for them to be healthy. So a patient like that, we might say, hey, listen, we could really do something really powerful for you with some clear aligners. Get the teeth aligned, gums much healthier, added benefit, the smile will improve as well.
Gotcha. Also, I want to talk about grinding. I've heard people say, man, I wake up and my jaw hurts.
Sure.
What's the cause of that?
So sleep grinding is a subconscious habit, or bruxism is what the technical term for it. It is, when I'm talking to my patients, I sometimes compare it to restless leg syndrome, right? Which is just a nervous tic that you have that you can't really control. Sleep grinding happens obviously when you're asleep, And so the risk there is that you can do a lot of damage, not only abnormal wear to the teeth, but cause some chronic fatigue or tension in the chewing muscles, or problems in the TMJ, which is the joint that articulates your lower jaw to the skull. If you left this problem untreated, you have people who are suffering from, like you said, chronic headaches, muscle tension, inability to chew their food effectively. Usually what we recommend for these people is an appliance called an occlusal splint or a night guard, something we also fabricate here in the office, which you wear at night and just basically protects you from killing your teeth.
Oh, wow. So you make that in the practice?
Absolutely.
Would you mind showing us the technology?
Absolutely.
So what is same-day dentistry? I've heard that term many times. Could you explain that, please?
So same-day dentistry to us here in the office is an idea that if you come in for a routine exam or cleaning, one of your routine dental appointments, and we catch something that needs attention, some sort of small dental problem, or even if it's a bigger dental problem, we have the ability to treat that problem here in the office, give you a solution, a resolution, without having to require you to come back and forth to the office for several trips. I think that this is really important, particularly now in the age of the COVID-19 outbreak, where we're trying to minimize the number of times that people come in and out of the office, to minimize the risk of virus transmission to our patients and to our team here at the office. So basically, what it means is if we catch something in the cleaning chair, we move you right over to my chair, we get the filling done for you, we get the root canal done for you, the crown, and then you leave here with the problem solved.
Okay, very good to know. So talking about COVID-19, how has that impacted your practice? Because I know, your practice, dentistry in particular, there are a lot of fumes and people might have some concerns. So what are you doing to alleviate some of the anxiety people may have?
Sure. I mean, this COVID-19 outbreak has been really crazy. Yeah. It's created a lot of stress and anxiety, not only on our end, but also in the minds of our patients. So the first thing that we're trying to do is be very communicative about everything we're doing to keep everybody safe. And it's just as important for us to maintain the safety of our team as it is for our patients. We have an exhaustive list of protocols and procedures that we have changed to make sure that patients know that we're going above and beyond to protect their safety. That's from enhanced arrival protocols to enhanced disinfection protocols. We're wearing tremendous amounts of PPE and just doing a lot of things. We've changed the type of disinfection that we're using, the frequency of disinfection that we're using. We have social distancing here in the office, and also minimizing the overlap of patients here in the office. Whereas before we might have multiple patients in the rooms at the same time getting cleanings and dental work, we're really trying to cut down on that so that we can eliminate the risk as much as possible.
Awesome. So can you just show me some of the technology you have in the office?
I would love to.
All right, let's take a walk. All right, so you're just gonna show us what exactly is that piece of contraption over here?
So this little magic wand here, this really expensive little magic wand, is our Trios 3-Shape intraoral scanner. And this technology is amazing. It has replaced what are considered traditional dental impressions here in the office, so that we can create, this is our entry point for our digital workflow. What you see here is an optical impression that we have created for our patient. We do this, it took me 1 minute and 11 seconds to scan this patient's entire lower arch. As you see, we have a very detailed 3-dimensional rendering of the patient's teeth that not only includes anatomy, it includes shade detail, it includes measurements of height, and very, very detailed information that allows us to diagnose, treatment plan. We can start to develop our night guard fabrication, clear aligner fabrication. You can use this to start making digital dentures, surgical guides. Sky's the limit, really.
So what is this piece of contraption here?
Okay, so we were talking about our enhanced disinfection protocols.
Yes.
So one of the things that we have incorporated here in the office is we have a device that allows us to generate hypochlorous acid, a very potent disinfectant. which we're using to disinfect the office space. This is an ultra low emission fogger, which once we generate the hypochlorous acid, we put it into this tank, and we're able to mist or fog the office so that we can get our disinfection into some of these hard to reach places. Think underneath the countertops or underneath the handles where people are touching and virus can be sitting, so that we are really going above and beyond to keep everything safe in here.
Awesome. What is this? This looks pretty
this
high tech.
when this arrived, it was like Christmas for me. I was so excited. This is my Formlabs 3D printer.
Yeah.
This is the last step of our digital workflow. So once we generate a digital impression from our intraoral scanner, we can send it straight to our 3D printer for printing dental models. So the optical impression you saw can end up like a model of somebody's teeth. We also can generate digital design files with some of our partners to fabricate our occlusal splints or night guards, excuse me. So you have an example of that right here, which we have all fabricated all of this here in-house. This has the ability to print models. It has the ability to print surgical guides for dental implant treatment, night guards, provisionals. You could do crown and bridge here if you wanted to. Definitely digital dentures, which is a very exciting process as well. So this is my baby. I've loved learning how to use it, and we're kind of ripping through it at a high rate now.
Awesome.